ng kamay.
Gamit ang tubig at sabon tayo na sabay-sabay.
Iwas sa sakit ay isipin, kalusugan ay unahin natin.
Linis na paligid sa bahay, nagsisimula. Bahay ko, bahay mo. Huwag kung saan-saan nagtatapon ng basura. Tapon nyo. Huwag dudumi sa ilog o lawa, pagkat tayo rin ang makikinabang sa bayang may kalinga. Bayang kay sigla. Malinis na tubig at kapaligiran, dulot ay mabuting kalusugan. Buhay na mapayapa, buhay na kay saya. Tayo ay magtulungan at magkaisa.
Linis na tubig sa bawat komunidad.
Karapatang panitubig ang handog sa lahat ng edad. Nanay, tatay, ate, kuya, ito ang susi sa ating kalusugan. Nararapat lang na pahalagahan para sa bayang may kalinga. Bayang kay sigla. Malinis na tubig at kapaligiran,
Dulot ay mabuting kalusugan.
buhay na mapayapa, buhay na kay saya. Tayo ay magtulungan at magkaisa. Malinis na tubig sa komunidad upang sakit ay yung maiwasan.
Maging malinis sa kapaligiran upang sakit ay iyong maiwasan.
Maghugas lagi ng ating kamay upang sakit ay yung maiwasan. Tubig, paligid at pangangatawan para sa atin ngayon at sa kinabukasan. Bayang may kalinga, bayang kay sigla. Malinis na tubig at kapaligiran, dulot ay mabuting kalusugan. Buhay na mapayapa, buhay na kay saya. Tayo ay magtulungan at magkaisa. Tayo ay magtulungan at magkaisa. Match for all communities!
Enabling change and uplifting communities. This is the driving force behind Manila Water Foundation.
Manila Water Foundation is the heart of the Manila Water Company.
Established in 2005 as Manila Water Company's social development arm, MWF has since become a non-stock, non-profit organization accredited by the Philippine Council for NGO Certification and recognized by related government agencies. In 2017, MWF shifted to focus on WASH. WASH, or Water Access Sanitation and Hygiene Education, leverages on Manila Water's business expertise.
Manila Water Foundation's vision is to be the enabler of change through sustainable water access, sanitation, and hygiene education for marginalized communities in the Philippines. And the Foundation's mission is to create and implement participatory and responsive WASH programs contributing to holistic community development.
To contribute to the global social development agenda, the Foundation anchored its advocacy to the United Nations Sustainable Development Goals.
Internationally, we are aligned with the UN SDGs, or the UN Sustainable Development Goals. SDG 1, No Poverty. SDG 3, Good Health and Well-being. SDG 6, Clean Water and Sanitation. SDG 14, Life Below Water, and SDG 17, Partnerships for the Goals.
MWF empowers communities through a holistic and integrated WASH program following a three-stage approach. Water access. Safe, clean, and potable water is made available through developing water supply systems. Sanitation. Safely managed sanitation facilities or toilets are made accessible for proper waste containment, disposal, and management. Hygiene. Educational institutions and communities will be educated on proper hygiene practices to reduce health risks at all times. This is made in a participatory approach where the community takes ownership and WASH becomes the community's agenda.
Masaya at na karoon kami ng tubig binigay ng Manila Water Foundation. Masaya kami. Hindi nun kaya namin masukli nito. Ang sobrang saya po namin doon sa aming komunidad.
May minsan na naranasan namin na hingian na lang ng tubig. Ngayon, sawa kami sa tubig. May gripo pa. Ang tubig po talaga, importante sa buhay ng tao yan. Kasama ng buhay ang tubig na yan.
The integrated WASH program is at the core of MWF, which brought forth the flagship programs. Lingap, providing safe, clean, and potable water to public institutions such as schools and health centers for drinking, hand washing, and toothbrushing. Ahon Tubig, building standalone water supply system and subsidizing piped-in water connections to low-income communities. Ahon Sanitasyon, providing communal sanitation facilities and interventions. Health in our hands, educating communities on the importance of proper hygiene practices as key for healthy living. Moreover, the foundation is able to reach more people throughout the years through its special programs. Agapay Tubig, deploying drinking water to communities affected by disasters, and Agapay Sanitasyon, constructing sanitation facilities like transitional toilets in communities displaced by disasters and calamities. In 2015, the foundation launched the Prize for Engineering Excellence, which recognizes notable Filipino engineers whose innovations helped solve development problems in the areas of water, sanitation, sustainability, and the environment. With this is the Experts Bureau, a circle of the prize's awardees who can be tapped as resource persons or consultants in WASH-related activities. Manila Water Foundation's programs are made possible by its partners and the WASH volunteers, a pool of Manila Water enterprise talents and external stakeholders who selflessly give their time and resources to MWF's initiatives.
Looking forward, Manila Water Foundation envisions to scale up and expand our initiatives. And this has been made possible with all the stakeholders and partners. We will commit that we'll be able to resolve WASH issues one community at a time. We hope that our impact will be more meaningful. And when we leave the community, that community can be sustained by the community itself. Sa bawat tahanan na aming pinapasok, sa bawat pamilya na aming kinakausap, at sa bawat bata na aming inaalagaan, ito ang higit na nagbibigay sa aming inspirasyon para maipagpatuloy ang aming hadikain na mapagbigay ng malinis na tubig, ng maayos na palikuran sa bawat komunidad. We will continue our efforts to provide clean and safe water and safely manage toilets so that we could provide the dignity and hope for every family. This is what we have signed up for, and we have only just begun.
tayo upang ipagdiwang ang Health in Our Hands World Oral Health Day 2019.
Hinihiling po namin na pagpalain ninyo ang mga dentista at kanilang mga kawani. Bigyan niyo po sila ng lakas at inspirasyon na maisakatuparan ang gawang ito para sa aming mga mag-aaral.
There is so much we can achieve for the health for all Filipinos together. The goal of the oral health program of the DOH is to attain quality of life through promotion of oral health and quality oral health care.
Tuturuan namin kayo ngayong umaga na ito kung paano yung tamang pagsisipilyo.
Bilang isang dentista, nakikiusap kami at ipinararating namin sa inyo ang isang mensahe. Ang pagkain ng sobrang matamis at sobrang daming matamis ay masama sa ngipin. At hindi lang ito sa ngipin, pati na rin sa pangangatawan.
Pangangalaga po ng ating bibig ay hindi lang nakatuon sa mga dentista. Ang pangangalaga ng bibig ay primarily sa inyo po bilang individual. Kasi kayo yung magtutoothbrush sa araw-araw. Kami lang po ay tutulong sa inyo para mapanatili ang inyong kalusugan at kung may nagkakaroon ng mga problema.
So kapag soft yung bristles natin, mas mapoprotektahan natin yung enamel ng ating ngipin. Masusugatan po yung gum. Masusugatan daw yung gum. So yun yung number 2 natin, no? So kaya kailangan natin ng soft bristles.
Kasi kapag electronic, hindi po niya nakikita kung alin po yung mas madali.
So mga mag-aaral ng Binyan Integrated National High School, sa ating mga guro, maraming pong salamat sa muli sa pagkakataong ito at ating pong tandaan, tayo ay sama-sama para magtaguyod ng isang malakas at malusog na pamayanan at buong Pilipinas. Magandang umaga po at maraming pong salamat sa inyong lahat.
The story of a 100% Filipino-owned company is the story of the Filipino family. For generations, families trust brands that offer solutions, responding to their needs. Filipinos remain loyal to brands that their families have trusted for generations. Filusa Corporation is a trusted market leader of fast-moving consumer goods, or FMCG, and pharmaceutical products in the Philippines. Its brands have become one of the most reliable and widely used brands of Filipino households. The company's vision is to be the leading Filipino-owned company that provides world-class quality and affordably priced health and wellness, baby care, personal care, and home care products, locally and internationally, resulting in being a source of pride for for its customers, business partners, employees, and shareholders. The well-known Filipino value of malasakit is very evident in the strong family culture of Filusa. On top of it, the employees consistently embrace its other values of customer first, passion for excellence, sense of urgency, and malasakit. Every member of its team knows the company's purpose, which is to touch the lives of families anywhere in the world. Filusa successfully launched Rhea Generics, the unique brand of generic medicines developed in partnership with the global leaders in the pharmaceutical industry. The story of Filusa, being a testament of the Filipino family, is a proud recipient of the following awards. Filusa Corporation see these accolades as an opportunity to further expand its horizons as it reaches more families beyond the Philippines. The story of Filusa has just begun. Filusa, touching the lives of families anywhere in the world.
Beautiful smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health for you and me.
Beautiful smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health for you and me.
Happy and healthy, cheerful family, building a stronger community. With your dentist and his practice, a blessing to you and me. Beautiful smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health for you and me. Happy and healthy, cheerful family, building a stronger community. With your dentist and his practice, a blessing to you and me. Beautiful smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health, better health, better health for you and me.
Hello everyone! Kumusta kayo at kumusta ang inyong mga ngiti? Are you #mouthproud? Welcome to the World Oral Health Day 2021 virtual celebration. I am Nix Hipolito from Manila Water Foundation. You are about to enjoy a broadcast co-presented with the Philippine Dental Association in collaboration with the Department of Health and the Oplan Kalusugan sa DepEd or OK sa DepEd. This event is brought to you by our corporate partners, our major sponsor, Filusa Corporation, makers of Clean Clio toothbrush, and our sponsor, Lamoyan Corporation, makers of Happy Toothpaste. Now, did you know that World Oral Health Day is celebrated every 20th day of March? This is to raise awareness and share knowledge on proper oral hygiene practices, which contribute to overall health and well-being. In Manila Water Foundation's program Health in Our Hands, the annual campaign encourages the public and target stakeholders to take care of their mouth by brushing teeth properly, visiting the dentist regularly, and eating food that are nutritious and healthy. Kaya naman shoutout po sa ating mga students mula sa ating mga school partners at sa mga kasangga or community partners na nanonood kasama ang buong pamilya. Okay, konting trivia po para sa ating lahat. Alam niyo ba kung bakit March 20 ang World Oral Health Day celebration? Dahil ayon sa mga eksperto, senior adults who will have 20 natural teeth at the end of their life are considered healthy. Children should have 20 baby teeth, no? And healthy adults should have 32 teeth and 0 dental cavities. Ayan. Kaya naman, when we translate these to numerical values, we have 320. Therefore, it is March 20. Ayan, ang daling tandaan, di ba? Okay, now, on to our celebration. To welcome us this afternoon is the Executive Director of Manila Water Foundation, and here he is, Mr. Reginald M. Andal.
Maraming salamat, Nix. Magandang hapon, mga katubig. It is our pleasure to have each one of you today for our celebration of the World Oral Health Day. World Oral Health Day is a global campaign which aims to empower everyone with the knowledge, tools, and confidence to secure good oral health. The theme for the next 3 years sends out a simple but powerful message. Be proud of your mouth. Why? Because a healthy mouth enables us to eat, speak of kindness and positivity with smile and laughter, and socialize without pain, discomfort, or embarrassment. In other words, let us all value and take care of our mouth. Focusing on the importance of oral health can inspire everyone to take action of our overall health and well-being because good oral health can help us live a longer, healthier life. This celebration is part of Manila Water Foundation's advocacy, WASH, which stands for Water Access, Sanitation, and Hygiene. It is our third year of celebrating this global campaign. This year, we take on the challenge to reach more Filipinos through a wider and more inclusive campaign featuring series of digital advocacy activities throughout the month of March. In our country, oral disease continues to be a serious public health issue. 87.4% Filipinos are suffering from tooth decay, and 48.3% has gum diseases, the two most common oral health diseases. But there are so many ways that this can be prevented. And it starts today through our collective efforts with our institutional partners, the experts from Department of Health, Department of Education, and Philippine Dental Association, who all joined us today to impart knowledge and share reminders on proper oral health care. Department of Health, who is our partner in providing WASH in communities under the Bida Solution Plus campaign, and Department of Education, who is our partner in providing WASH in schools under the OK or Oplan Kalusugan sa DepEd, whose expertise have helped us advance our WASH advocacies. Philippine Dental Association, who is our partner since we started this campaign, in promoting oral health awareness and education toward the delivery of oral healthcare services to the public, especially our unserved and underserved communities. We are also thankful to the corporate partners, Elisa Corporation for Clean Clio Toothbrush and Lamoyan Corporation for Happy Toothpaste, who journey with us in promoting proper oral health practices, not only to schools, but also to communities. To lead this kind of advocacy is not an easy task. Thus, we seek these like-minded organizations to reach more people in the country. We are very thankful to our partners who tirelessly support us to make our yearly campaign successful. And now that we are in a pandemic, the need for hygiene interventions has been highlighted. Over 7 million people do not have access to a basic hygiene facility within their homes. Almost half of all schools in the Philippines do not have group hygiene facilities with water and supplies available for their students. And unfortunately, even many barangay or healthcare facilities do not always have functioning hygiene stations. This is why we complement our virtual celebration with the construction of hygiene facilities and distribution of hygiene packages with IEC materials to different cities and provinces, as well as schools and special institutions under the pivotal program of WASH in pandemic. Since the pandemic occurred, we have already installed 51 hybrid hygiene facilities, including 13 in public schools, benefiting more than 300,000 individuals, and 44 hygiene facilities in public schools in 2019, benefiting more than 150,000 students and teachers. Our virtual celebration event today is a demonstration of our collective effort and impact, working together to create the enabling environment and the right conditions for good hygiene practices in schools and communities. Let us continue working together in providing access to wash facilities and sharing knowledge on proper hygiene practices, both hand washing and toothbrushing, giving our younger generation a brighter future. We can show our care to the people around us. Let us all be ambassadors of good health by starting with something as basic as proper hand washing with clean water and soap, and toothbrushing with flossing and regular visit to dentists. For many of you watching today, especially to our parents, teachers, community leaders, and institutional partners, let us start embedding proper hygiene practices within our daily lives. We can make sure that it is easy for our learners and community residents to properly wash their hands and brush and floss their teeth in school and at home, instilling this good hand hygiene habit for a healthier and safer Philippines. Manila Water Foundation commits to continue bringing wash for all communities. Happy Oral Health Day, everyone. Wash up, wash up!
Thank you so much, Sir Reg. Ayan, maraming salamat po sa inyong mensahe. Okay, mga kaibigan, isa pang trivia. Alam nyo ba na ang World Oral Health Day ay sinimulan ng FDI o Federasyon Dentaire Internacional, World Dental Federation? Ito ay ang samahan ng mahigit sa 1 milyong dentista sa buong mundo upang maisulong ang wastong pangangalaga ng bibig o proper oral health. Kaya naman, it is our honor to have the President of FDI World Dental Federation, Dr. Gerhard Seeberger.
Greetings, everyone. While I regret we're unable to meet in person, I trust that this message finds you well in good health. And be sure, even if we meet only virtually, I could not feel closer to you today. As President of FDI World Dental Federation, I wish you a happy World Oral Health Day. Many thanks to our FDI member, the Philippine Dental Association, as well as the Manila Water Foundation for bringing us together. Thanks to their enthusiastic support and commitment, we come closer to our vision of leading the world to optimal oral health. As you know, World Oral Health Day is the largest global awareness campaign on oral health. Today, I challenge you to be proud of your mouth. Good oral health can help you live a longer, healthier life. By adopting good oral hygiene habits today, you can serve as a lasting, important example to your family, friends, and community. And have in mind, it's better to have a good and fresh glass of water than any sugary drink. The change starts with you. Thank you, one and all. And once again, happy World Oral Health Day.
Dankashon. Thank you, Dr. Seeberger, for sharing with us what this celebration is all about. Once again, the theme for the next 3 years sends a powerful message to all of us. Be proud of your mouth. We must value and take good care of our mouths because good oral health can help you live a longer, healthier life. At sa panahon ng pandemya ngayon, mahalagang pangalagaan natin ang ating mga bibig dahil isa sa paraan ng transmission ng COVID-19 ay ang pagpasok ng virus sa ating bibig. Ayan, to help us understand more about taking charge of our oral health, we are also lucky to have with us today Dentist 4 of the Department of Health, Disease Prevention and Control Bureau. Let's welcome Dr. Rochelle Pambid.
Good afternoon. The Department of Health is one in commemorating World Oral Health Day with this year's theme, Be Proud of Your Mouth. And we are delighted to be part of this celebration spearheaded by the Manila Water Foundation and the Philippine Dental Association. The World Health Organization defines oral health as a key indicator of overall health, well-being, and quality of life. It encompasses a range of diseases and conditions that include dental caries, periodontal disease, tooth loss, oral cancer, oral manifestation of HIV infection, and birth defects such as cleft lip and palate. The Global Burden of Disease study in 2017 estimated that oral disease affects 3.5 billion people worldwide. Oral health diseases are rarely a matter of life and death, but they remain a significant health problem because it impacts the quality of our lives. In the Philippines, the two most common oral diseases are dental caries or tooth decay and periodontal or gum diseases. Toothache is a common ailment among school children and is the primary cause of absenteeism that affects their school performance. The problems in our mouth can affect the rest of our body because it serves as an entry point of bacteria through the food and other substances that we take that causes diseases. Most oral health conditions and diseases are largely preventable and can be treated in their early stages, and maintaining good oral health has a positive impact on our general health, well-being, and quality of life. Most oral diseases and conditions share modifiable risk factors with the leading non-communicable diseases such as cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes. These risk factors include tobacco use, alcohol consumption, and unhealthy diets, high in free sugars, all of which are increasing at the global level. There is a proven relationship between oral and general health. For example, that diabetes mellitus is linked with the development and progression of periodontitis. Moreover, there is a causal link between high consumption of sugars and diabetes, obesity, and dental caries. In addition, according to the International Agency for Research on Cancer, cancers of the lip and oral cavity are among the top 15 most common cancer worldwide, with nearly 150,000 deaths each year. We strongly encourage everybody to live a healthy lifestyle by eating a well-balanced, low-sugar diet, practice good oral hygiene, regular visits to the dentist at least twice a year, avoid tobacco use, and limit alcohol consumption. Most people that have long-existing oral health problems could still be treated, but the idea of educating young people has shown to be more effective. Through education on proper oral hygiene, the next generations of young people will be empowered to teach their children the necessity of having good oral health. This will serve as an investment that will save a generation free from oral health diseases. In comparison with a man holding a fishbowl, dentists have been granted a great skill that can help so many people. While treating people by their own power is praiseworthy, through teaching others, they can empower people to take charge of their oral health. Priority is given to the promotion of oral health and prevention of oral health diseases. Collaboration is also conducted with our partners and stakeholders like Philippine Dental Association and the Department of Health to ensure that the integration of oral health program is being implemented, like promoting self-care, proper toothbrushing technique and prevention with the use of fluoridated toothpaste, inclusion of oral health program in the health curriculum of schools to mobilize the teachers, health personnel, and parents to implement the program. The Department of Health National Oral Health Program's vision is that the Filipino people are empowered and responsible in taking care of their own oral health for an enhanced quality of life. In order to achieve the vision, the mission is that the state shall ensure quality, affordable, accessible, and available oral health care delivery in line with the universal health care. On behalf of Secretary of Health Francisco T. Duque III, Officer in charge of the Public Health Services Team, Office of the Undersecretary, Assistant Nestor F. Santiago, Disease Prevention and Control Bureau Director, Director Beverly Lorraine C. Ho, congratulations and be proud of your mouth. Thank you.
Thank you so much, Doc Rochelle, for that very informative message and reminding us that taking care of our mouth is as important as taking care of our whole body. All right. So, nakinig ba kayo sa ating mga speakers so far in our broadcast for this afternoon? Dahil now, it's time for our Ang Tanong Live. Ayan. I will now ask questions on what our speakers have shared so far or about the World Oral Health Day celebration. And so, comment down below for your answers. For those who will be getting the answers correctly, we will draw lucky winners who will receive a Clean Clio Hygiene package. Ayan. So, yan po ang ating mapapanalunan sa lahat ng tamang sagot. Winners will be announced at the end of this live event. So, stay tuned mga kaibigan. For our first question, question number 1. Tuwing kailan ipinagdiriwang ang World Oral Health Day? 3, 2, 1. And the correct answer is, ayan, baka may mga tama na sumagot dyan, March 20. March 20 po natin ipinagdiriwang ang World Oral Health Day. Ayan. Question number 2. Ano ang theme ng World Oral Health Day 2021 to 2023? I-comment natin down below ang tamang sagot in 3, 2, 1. Yan, ang tamang sagot ay be proud of your mouth. Ayan, be proud of your mouth. Bilisan na natin. Question number 3. Fill in the blank naman para medyo mas may challenge naman tayo. In the Philippines, the 2 most common oral diseases are blank and gum disease. Clue, 2 words po ito. And it starts with the letter T and letter D. In 3, 2, 1, ang tamang sagot po ay tooth decay. Ito ay the 2 most common oral health diseases pala, no? Ang tooth decay. Ayan. So, may nakikita na ako mga tamang sagot sa ating mga comment section. Just send them in. Ayan. At mga kaibigan, magra-raffle din tayo ng 10 100 peso load for those who gave their answers correctly. O, diba? So, there are really many chances of winning by joining in this broadcast. Kaya stay tuned until the end of the broadcast. And let us not forget, mga kaibigan, to like and share this live event right now that you're seeing so that we can reach more people as we raise awareness on proper oral health. Ayan. I-like na rin natin ang mga Facebook pages ng ating mga partners, ang Filusa Corporation at ang Clean. Ayan. At i-like na rin natin mga kaibigan ang Facebook page ng Lamoyan Corporation, Happy Toothpaste, Daz Dishwashing Liquid at Lice Alice. At syempre, ang Facebook page na rin po ng Philippine Dental Association or PDA. Ayan. So guys, mag-comment po tayo sa ng ating mga natutuhan today or ang ating mga key takeaways sa lahat po ng ating mga naririnig on how we can apply good oral health practices in our daily lives. Dahil mamimili po kami ng happy comments of the day who will receive a happy gift packs. Ayan, nakikita po natin sa ating mga screen ang pwede nyong mapanalunan when you send in your happy comments. Ayan, ito po yung ating mapapanulunan. What are your key takeaways during the sessions or words of wisdom from our experts na speakers natin ngayong hapong ito? Ayan, thank you. And so, Manila Water Foundation has been Department of Education's partner in implementing WASH in schools. Aside from hand washing, toothbrushing is one of the major activities of WINS. This afternoon, we are lucky to have the Chief Health Officer of the Department of Education, Bureau of Learner Support Services, School Health Division, to discuss healthy mouth for overall health and well-being. And here she is, ladies and gentlemen, Dr. Maria Corazon Dumlao.
On behalf of the Department of Education through the Bureau of Learner Support Services, School Health Division, I would like to thank one of our beloved partners, the Manila Water Foundation, for inviting me to take part in this occasion and give this message. There is an idiomatic expression which we use to describe the things that we fail to notice even though we should notice them because they are obviously just right there under our noses. As we celebrate today's occasion, I can't help but remember how our mouths are literally and sometimes figuratively under our noses. This is why I am thankful to be part of opportunities like today's celebration of the World Oral Health Day, where we can highlight the importance of having a healthy mouth for overall health and well-being, something that people do not generally recognize. According to the World Health Organization, the Global Burden of Disease Study 2017 estimated that 3.5 billion people worldwide are affected by oral diseases. The WHO further emphasizes how oral health is a key indicator of overall health, well-being, and quality of life. For instance, diabetes mellitus is linked with the development and progression of periodontitis, a gum infection. Moreover, there is a causal link between high consumption of sugars and diabetes, obesity, and dental caries. This calls for champions, such as all of us who are gathered today, who will amplify the message that oral health is integral to general health. In DepEd, we implement the School Dental Healthcare Program or SDHCP. Through this program, we help ensure that the high prevalence of dental caries among our learners in public schools is addressed and that the learners' oral health is improved through proper management. Institutionalized by DepEd Order Number 41 Series of 2020, the SDHCP aims to provide guidance to our basic education schools in ensuring that our learners have access to needed preventive and curative services, including immediate dental and medical emergency care in school. But the SDHCP is not a single program that we separately implement on its own. Instead, it is part of a package of programs under a convergence initiative that we call Oplan Kalusugan sa DepEd or OK sa DepEd. The implementation of the SDHCP is complemented and strengthened by medical and nursing services and other programs such as the school-based feeding program, water sanitation and hygiene or WASH in schools, National Drug Education Program, Adolescent Reproductive Health, and School Mental Health Program. We have designed our dental clinics to be holistic clinics not only with supplies and equipment for oral health, but for the other medical and nursing needs of our learners. In feeding our children through the school-based feeding program, we acknowledge that digestion and in effect nutrition begin in the mouth. We have included toothbrushing in the activities offered to our feeding beneficiaries. In substance use prevention through the National Drug Education Program, we acknowledge that most oral conditions have the risk factors as non-communicable diseases, among which are tobacco use and alcohol consumption. In the WOHD in schools, we recognize that water is essential to oral health, and we ensure that clean water is provided to dental clinics and the respective toothbrushing facilities. I can go on with my list on how oral health is linked as well with mental health or even with adolescent reproductive health, but I believe I have pretty much established my point. Borrowing our mantra in our mental health advocacy, I hope to emphasize the same about dental health. There is no health without dental health. As such, I enjoin all of us who are present today to continue to strengthen what we have already been doing for the oral health of our learners. We at DepEd look forward to establishing more partnerships with various stakeholders and local government units, especially in sustaining and improving our OK sa DepEd facilities to support the overall health status of our learners. Sa mga mag-aaral, mga guro at mga kapwa ko health personnel na virtually ay kasama natin ngayon, sa iba't ibang ahensya at organisasyon na nagsama-sama para sa pagdaraos ng gawaing ito, lubos po na nakakataba ng puso na makita ang iyong maiinit na pagsuporta. Kinikilala po ng DepEd na anumang gawain para sa kalusugan ng ating mga learners ay malaking ambag sa iisa nating adhikain. Hindi man natin magawang maipagdiwang physically ang araw na ito, hindi naman ito hadlang para ipagpatuloy ang ating advokasya. Nakasuot man tayo ng mga face mask at natatakpan man ang ating mga labi, dalangin kong hindi naman napapawi ang ating matatamis na mga ngiti. Muli, maraming salamat po at isang mapagpalang hapon po sa ating lahat.
Thank you so much, Dr. Dumlao. It is really our honor at Manila Water Foundation to support Oplan Kalusugan sa DepEd or OK sa DepEd in this advocacy. Kaya para sa ating mga magulang listening and watching us this afternoon, good oral hygiene at a young age will help our child or our children to be healthy in their lifetime and will boost performance at school. At syempre, kahit na sa pagsagot ng ating mga module sa bahay, hindi ba? Hindi nakakapag-aral ng mabuti ang ating mga learners kapag masakit ang ipin. Kaya at this World Oral Health Day, let us remind our children on how to brush and care for their mouths properly. Kasama din dito ang pagbisita sa dentist. At alam ko na marami sa atin ang takot sa dentista, no? At ang atin lang tatandaan, sila talaga ang tumutulong para maging healthy ang ating mga bibig. Nakabisita na ba kayo sa inyong mga dentista ngayong panahon ng pandemya? Ayan. To know more about visiting the dentist in the new normal, we are pleased to have from somebody from the Philippine Dental Association, the past president of PAFJO TMJ, and she is the dean of St. Anne College of Lucena College of Dentistry. Let us welcome Dr. Sheila Ortega Cobcobo.
We are all here to celebrate the World Oral Health Day. And my lecture today is visiting the dentist in the new normal. Pagtutuunan natin ng pansin ang ating mga ngipin. Magandang araw po sa inyong lahat. Tayo po ay dumaan sa lockdown nitong nagdaan na taon. We have been experiencing so much stress and we have been staying in our house. And now we can see that the new normal and we have to be prepared for the new future. And the world has been in mask. Lahat tayo ay nagsuot ng mask. Ngayon ba, are we ready? Ready na ba tayo? This is now the time for the new normal. And we have to love the present. Dapat mahalin natin ang ngayon. because this will be our future. And of course, when it comes to oral health, patuloy pa rin natin dapat pangalagaan at pagtuunan ng pansin ang ating ngipin. At ito ay dapat pangalagaan at huwag pabayaan. But now we have to consider and love to press it at ito ay tanggapin. And so, this oral health is very important. And still, we have to take note of how we're going to take precautions and to take steps in order to continue with our oral health promotion and oral health caring of our teeth, because the mouth, ating bibig, ay salamin ng ating katawan. Nakikita dito lahat kung ano ang kalagayan ng ating katawan. That's why it's very important to know our oral health. Every tooth in the man's head is very valuable like a diamond. Ang bawat ngipin natin ay mahalaga. That's why good oral hygiene at ang wasdong pangangalaga ng ngipin ngayon ay dapat natin malaman. Alam niyo ba na 3.5 billion people is affected by oral disease worldwide, and 27.90% aged 2 to 5 years old ay may tooth decay, and 51.17% aged 5 to 11 years old children are with tooth decay. So a great percent that is really need to consider when it comes to oral health care. Adults suffer from gum disease, and as you can see, 47% are experiencing gum disease problem like mild periodontitis, modern periodontitis, and severe periodontitis, and even kids. And these are the common dental problems like bad breath or may amoy na hininga, tooth decay or sirang ngipin, gum disease, or namamaga na gilagid. Pag masakit ang ngipin, nagkakaroon tayo ng maraming epekto sa ating katawan. At hindi lang doon, nararanasan natin na magkaroon ng toothache or sakit ng ngipin, magkakaroon tayo ng mga iba pang komplikasyon. Kaya naman, ang posibleng sanhi ng ating sakit sa ngipin ay maaaring bad breath, maaaring tooth decay, at gaya ng sabi ko kanina, gum disease or pamamaga ng gilagid. Ano-ano ang mga sintomas ng sirang ngipin? Sumasakit ba ang ngipin nyo? Ngumingilo ba ang ngipin nyo? Or may butas ba ang ngipin nyo? So ito, marahil ang sanhi ng pagkakaroon ng sakit ng ngipin nyo. But don't worry, be happy. Pwede pa nating itong gamutin sa mga paraan natin sa new normal. Kailangan natin tanggapin kahit na this is the new normal and oral health was neglected, now we are recovering. But change is always difficult, mahirap. But this particular change involves change with a great amount of fear. Natatakot pa rin tayo. Natatakot tayong lumabas, natatakot tayo sa dentista, natatakot tayong makipagsalamuha sa ibang tao. Pero huwag tayong matakot sa dentista. Huwag tayong matakot lumabas because kami ay kaibigan nyo sa pagkukonsulta at kami ay patuloy na namangangalaga kahit sa ngayong new normal because clinics now are open for business as here in the new normal. We are still here and we are going to cater your dental needs. Ngayon nga lang yung normal, dental clinics have a new normal dental services. And so, we follow safety protocols and our dental treatment is safe treatment. So, don't worry, huwag kayong mag-alala. You are safe in our care because we practice, we observe safety protocols. Safety protocols like before you leave your house, you brush your teeth and grab a mask. It is a must to go out with a mask. You can have be able to call or text to check before you arrive at the office, or you can wait in the car and we'll let you know and we're ready when we are ready for you to treat. Or also, we will measure your temperature upon arrival. We will be asking some of the screening questions related to COVID-19 as a precaution. Then, we have used hand sanitizers when you enter the office. You have to gargle, of course, either mouthwash it is in order to prevent, to decrease airborne germs. and only patients with appointments are allowed in the clinic, and one guardian or one patients need assistance and may or may not come. So we are limiting the patients that we cater in a day. So you should allow time for your dentist to disinfect between patients. Also, we practice social distancing. And also, you really need an appointment to go to the dentist. In order for this to happen, we must really practice safety health protocols. So tuloy-tuloy ang aming pangangalaga sa inyong clinic with the new normal dental service and protocols for safety. So these are the new normal essentials. New normal essentials like face mask. We have face shield, gloves, antiseptics, disinfectants. Now, we are in a modern age. We are in the age of instant technology. And so, online dentistry is being practiced. Ika nga, ito na ang makabagong panahon. Sa makabagong panahon, sa pamamagitan ng teknolohiya, tayo ngayon ay makakapagkonsulta. So, there is what we call as online dentist. Online dentist, teledentistry, uses information from technology and communications to provide dental care and education. And so, this is what we call as teledentistry or telemedicine. Here, patients are being monitored in remote site. Okay, we have a remote site for video conferencing. We can forward and store the consultation, and we can even use our cell phones, our laptops, and computer using the health applications. We can talk to your friendly dentist through teleconferencing. Telemedicine consultation from work to the clinic, clinic to work, just one click away. So that is our new normal. So dental treatment is now close, meaning we still need to follow this in order to cure and to treat you. And the dentist examines teeth, the dentist deep cleans your teeth, and the dentist gives prescriptions. In treating you, you should set goals. So you have to clean your teeth properly, brush regularly, at least twice a day. That is a good habit. Good habit with complete oral routine of brushing, of flossing, of gargling mouthwash, and of cleaning your teeth. And you really need to consult and go to your friendly dentist for cleaning and constantly regular checkups. So with this new normal, we have to look into the future. And with a positive outlook, the world will be a better place again. So we have to focus on action, and we can do more if we are together and we are in unity in this oral health care. So in result, there will be happy kids, there will be smiling kids, and the world will be a friendly place, and there will be beautiful smiles. And everybody will be happy. Kaya, pagtuunan natin ng pansin ang ating mga ngipin at lagi nating tandaan, ito ay dapat pangalagaan at dapat ingatan. Ito po si Queen's Momshi, Doc Sheila or taga Cobcobo, dahil ako ay maanak na kambal at kambal ninyong nangangalaga sa inyong mga ngipin. At your service, your friendly dentist. Happy World Oral Health Day. Magandang hapon po sa inyong lahat.
Thank you so much, Doc Sheila, for that very informative lecture. Gusto ko yung sinabi niyo, Doc, na ang ating bibig ay ang salamin ng ating katawan. At yung sinabi mong mahalin at tanggapin natin ang ngayon, kasama dito ang bagong paraan ng pagbisita sa dentista. Okay, so marami na ba kayong natutuhan sa ating mga speakers so far, mga kaibigan? It's now time for Ang Tanong Live. Ayan. Comment down below for your answers, mga kaibigan, at the lucky winners will receive a Clean Clio Hygiene package. Winners will be announced at the end of this live event. Okay, so question number 4 na tayo, ha? Okay, Fill in the blank. Ayan. Kailan magpapalit ng toothbrush or kailan nagpapalit tayo ng toothbrush every blank months, no? Gaano katagal tayong nagpapalit dapat ng ating toothbrush? Ayan. So alam nyo ba na ang Clean Clio toothbrush comes in 3 variants? So they have Clean Clio Economy, Clean Clio Green Tea, and Clean Clio Charcoal Toothbrush. O ayan, comment down below ang mga sagot natin. Ang tamang sagot sa ating tanong ay every 3 months. Ayan, every 3 months. Dapat nagpapalit na tayo ng toothbrush kapag hiwa-hiwalay na yung mga bristles nito o kapag kagagaling mo lang sa sakit, no? So kailangan mong palitan ang iyong toothbrush. And make sure that you use Clean Clio. Ayan, question number 5. Ito naman. True or false? Madali lang ito mga kaibigan. The World Oral Health Organization defines oral health as a key indicator of overall health, well-being, and quality of life. Is this true or false? In 3, 2, 1. Napakasimple. Ang tamang sagot po ay true. Ayan, totoo po yan, no? Ang ating overall health, well-being, and quality of life ay nakasalalay din sa ating oral health. Alright, question number 6, mga kaibigan. Ito, true or false ulit. Madali lang din ito. True or false, good oral health contributes to quality education, no? Sa ating pag-aaral, lalo na sa ating mga kabataan na nanunood mula sa kanilang mga tahanan. Is this true or false? 3, 2, 1. And the correct answer, of course, is true. It is true. So kapag tayo malinis ang ating mga bibig, walang sira ang ating mga ipin, mabango ang ating hininga or walang amoy ang ating hininga, we can really learn so much more. Kaya ang tamang sagot dyan ay true. Question number 7. Guess the word. Ito, guess the word. Medyo challenging ng kaunti. Guess the word. Sa new normal, kung nakinig kayo sa talk ni Doc Sheila, tayo ay makakapagkonsulta sa ating mga dentista sa pamamagitan ng teknolohiya. Ito ay tinatawag na, ito nakikita natin sa ating screen, complete the word. It starts with the letter T and ends with the letter Y. Ayan, i-comment po natin down below ang ating mga sagot. And I think my colleagues are already seeing the correct answers now. In 3, 2, 1, the correct answer is teledentistry. Ayan, teledentistry. So, wag po kayong mabahala, no? Pwede po kayong magpakonsulta sa inyong dentista gamit ang teknolohiya. Ayan. Okay, question number 8. Ito, madali lang din. True or false? Sa pagbisita sa ating dentista sa new normal, hinihikayat na siguraduhin nakapag-toothbrush na bago lumabas ng bahay at magsuot ng mask papunta sa mga dental clinics. Is this true or false? 3, 2, 1. And the correct answer, of course, is it's true. Ayan. Isa sa mga bagong pamamaraan, kailangan nating magsuot ng face mask at sa ating pagkonsulta sa ating mga dentista. So that is true. Ayan. So ang dami nang nakakuha ng tamang sagot at abangan ang listahan ng ating mga winners mamaya at the end of our broadcast. And now, ladies and gentlemen, we have a very special guest in our celebration for this afternoon. He is an inspiration to the youth, especially in the field of academics. In grade school, he graduated as class salutatorian. Valedictorian naman siya nung high school at summa cum laude nung college. He is a TV host and the summa cum laude of PBB 8, our World Oral Health Day 2021 ambassador. Here he is, Sky Quizon.
Hi everyone, Sky Quizon here. Toothbrush ka na ba today? Well, marami sa atin iniisip na ang oral health care is just about brushing your teeth. Well, you're wrong. Bukod sa pagtutoothbrush, kasama rin sa good oral health care ay ang pagpo-floss ng ngipin, regular visit to your dentist, and syempre ang pagkain ng mga masusustansyang pagkain. Ako, I make sure that I visit my dentist regularly to check on my teeth at para siguraduhin wala akong bulok na ngipin at iwas syempre sa bad breath. I brush my teeth regularly. Kahit sa tapings and shootings, I make sure meron akong dalang toothbrush. I make sure that my breath is fresh. Oral healthcare is as important as washing your hands. You do it regularly, syempre, to make sure that you are disease-free. Did you know that March 20 is World Oral Health Day? Yes, it's the day where we get reminded for the importance of a clean and healthy mouth. Not just your teeth, of course, but your whole mouth. Thank you to Manila Water Foundation and Philippine Dental Association for leading this very important campaign. So guys, do take care of your oral health. Brush your teeth, visit your dentist, and of course, eat nutritious food. This is Quizon reminding everyone to smile and be mouth proud.
Thank you, Sky, for being one of our celebrity ambassadors, and thank you for sharing your tips, especially to our young viewers this afternoon. Kaya ako rin, mga kaibigan, lagi kong dala ang aking toothbrush, ang aking Clean Clio toothbrush. Ayan. So now, before we announce the happy comments of the day, meron po akong bonus question para sa ating lahat. Meron po akong tanong at ang mananalo ay makakatanggap ng happy gift pack. Ayan. Ang aking tanong po ay, ano ang first Filipino toothpaste brand na kinilala ng Philippine Dental Association? Ito ay may 1,500 parts per million or ppm na fluoride content. Type natin sa ibaba ang ating tamang sagot in 3, 2, 1. And obviously, our answer is Happy Toothpaste. Ayan, Happy Toothpaste po is recognized by the Philippine Dental Association. Alright, ayan, mamimili na tayo ng ating happy comments of the day. Ayan, so we can now flash our first comment. Congratulations! Ang ating first commenter ay si Marilyn. Ang sabi niya dito, I learned that we should be an ambassador in practicing proper hygiene, cleanliness, and proper toothbrushing, lalong-lalo na sa mga kasama natin sa bahay, sa mga taong nakakasalamuhan natin, at sa ating mga anak. Ayan. Thank you so much, Miss Marilyn, for participating. You are one of our winners sa happy comments of the day. Let's now bring in our second happy comment. Ayan, si Leo naman, no? Ayan, ang sabi ni Leo, sandali, basahin ko ha. Ayan. Ang natutuhan ko ngayon sa inyo ay panatilihing malinis ang ating mouth. Dapat habang bata pa, tutukan ang paglinis sa kanilang mouth para di sila magkaroon ng disease ng dahilan ng pagkabulok ng kanilang ngipin. Ayan. So thank you so much, Leah, for participating. And congratulations because you are a second winner of our happy comment of the day. Ayan. Thank you so much and keep sending us. So yung dalawang winners na yun, no, kindly send us a message through the Manila Water Foundation Messenger account for details on how to claim your prize. Ayan. Alright. So, handa na ba tayong matutuhan ang tamang paraan ng pagtutoothbrush? But before brushing your teeth, always make sure to keep your hands clean. Kaya sabi namin sa Manila Water Foundation, hey, wash up, wash up. At upang paalalahanan tayo ng tamang paraan ng paghuhugas ng kamay, muli nating sabayan ang aming mga kaibigan. Sila ay aawit at maghuhugas din ng kamay. Sila ay si Kuya Melvin at Ate Pam ng Manila Water. Let's all watch this.
Mga kamay ay basain, ang sabon ay kunin. Kuskusin ang ating palad at likod ng mga kamay. Pagitan ng daliri, likod ng daliri. Hinlalaki mga dulo at saka pulsuhan. Mga kamay ay basain, ang sabon ay kunin. Kuskusin ang ating palad at likod ng mga kamay. Pagitan ng daliri, likod ng daliri. Ilalaki mga dulo at saka pulsuhan.
Wow! Ayan, sigurado na tayong malinis na ang ating mga kamay. Kunin na natin ang ating mga toothbrush at toothpaste, sama-sama tayong matuto tungkol sa tamang paraan ng pagsisipilyo. Kasama natin ngayong hapon mga kaibigan si Doc Joy Garcia, ang President ng PAFJO TMJ, to teach us about proper toothbrushing. Hello, Doc Joy! Thank you for joining us today as we raise awareness on proper oral health in celebration of World Oral Health Day.
Magandang hapon, Nix, at sa lahat ng mga nanonood ngayon this afternoon.
Ayan, Doc Joy, gusto mo bang ipakilala ang kasama mo ngayon dyan sa studio?
Narito po si Dino, ang ating model, kasama natin at tutulungan tayo sa ating toothbrushing.
Wow, ayan. So, Doc Joy, unang tanong po, bakit natin kailangang magsipilyo?
Importante po yung pagsisipilyo natin, kasi yung brushing helps remove yung mga bacteria at plaque sa bibig na nagkukos ng tooth decay at gum disease. So marami pong bacteria sa bibig natin na kailangan natin linisin araw-araw. Tulad din ng pagliligo natin araw-araw, di ba? So pagka may masakit sa ngipin natin, apektado yung buong katawan. So pagka ang mga estudyante, kunyari may masakit ang ngipin, mahirapan sila mag-concentrate sa pag-aaral nila. So ang magandang ngipin ay ngiti ng pag-asa.
Thank you so much, Doc, for that answer. Kaya naman napaka-importante mga kaibigan ng pagtutoothbrush para maiwasan natin ang iba't ibang mga sakit at manatili tayong malusog. Doc Joy, ayan, meron po tayong mga partners dito sa Manila Water Foundation na may mga tanong po tungkol sa pagtutoothbrush. Ang first question mula sa isang mag-aaral in Luzon, mula sa Manggahan Elementary School in Pasig City. Hey, wash up, wash up!
60 Luis Kaligayan ng Manggahan Elementary School. Doc, ilang beses po dapat mag-toothbrush sa isang araw at tuwing kailan po ito?
Okay, Stacy, maraming salamat sa tanong mo. So, it is recommended that everyday brush should be at least twice a day. So pagkagising natin sa umaga at bago tayo matulog sa gabi. So mas maganda magawa rin natin yung pagtutoothbrush tuwing pagkakain. Kung maganda kung may baon tayo palaging toothbrush, so kahit saan tayo magpunta, pwede nating gawin ang brushing.
Ayan, thank you, Doc. Gusto ko yung paalala niyo, Doc, na magdala ng toothbrush. Kaya lagi akong may bit-bit na toothbrush na Clean Clio. Ayan. So, thank you, Doc. Meron din po tayong tanong, Doc, mula naman sa Visayas. Let's watch this.
Hi, ako si DK, taga-Barangay Kinasangan, Pardo, Cebu City. Usa ko kainahan nga adunay duha ka anak nga ang edad unom ug usa ka tuig. Ang akong pangutana mao kini. Unsa kadaghana nga toothpaste ang saktong gamiton sa pagsipilyo?
Mami D, sa pagpipili po ng ating tamang toothpaste, so tingnan po natin yung fluoride content ng toothpaste. So kailangan po nasa 1,000 parts per million of fluoride content ang meron para sa mga edad 5 taong gulang pababa. So, 1,500 ppm naman po para sa mga 6 na taong gulang pataas. So, yung fluoride po kasi, yun yung nagpapatibay sa ngipin natin. So, kailangan alamin din natin kung gaano kadami ang toothpaste sa ating sipilyo. So, sa mga edad 3 gulang pababa, so at least konti lang po, gabutil ng bigas, ang dami ng toothpaste. So, sa mga edad 4 na taon hanggang 5 taong gulang, kailangan po, kasing laki ng munggo, ang dami ng toothpaste sa toothbrush. Pagka naman po, 7 taong gulang pataas, kailangan po kasing laki ng buto ng sitaw or medyo puno na po yung ibabaw ng toothbrush natin. So, ganun po yung dami ng toothpaste na kailangan nating gamitin.
Wow, that's very informative, Doc Joy, no? Kaya naman, pag pumupunta tayo sa ating mga supermarket, tingnan po natin yung label ng ating mga toothpaste na dapat meron tayong 1,000 parts per million sa ating toothpaste, no? At isa sa ating mga kaibigan ngayon sa ating broadcast ay ang Happy Toothpaste, no? At kinikilala sila ng Philippine Dental Association. Ayan, very informative po yung inyong response, Doc, no? Ito naman po, Doc, meron tayong last question, this time from Mindanao. Pakinggan po natin ito.
Buenos días a todos y buenos días también, Doc. Yo si Señorito Osle Pipaipa, un maestro de Escuela Central de Ayala SPED Center aquí na Ciudad de Zamboanga. Doc, tiene yo dos preguntas. El primero, Cosa el magajusto manera si tasipilya gente. El segundo, yo vi yo de antes, hindi mas necesita asemumug el boca después de cepillar el gente. Verdad ba este? Gracias na dito yung contestasyon, Doc.
Gracias, Mr. Soler. Okay, sabay-sabay po nating alamin ang tamang pagsisipilyo ng ngipin. So, narito po si Dino, no? Tutulungan niya tayo kung paano. Ito po, si Dino, makikita niyo po, ano? So, alamin po natin ang tamang pagsisipilyo. Ayan, kailangan po yung pagsipilyo natin, yung from inside, galing po sa loob, pataas, sa loob, sa likod ng ngipin natin. Pag ganito po. Pag sa itaas naman, galing sa loob, pababa naman po. Sa harap, sa likod, ayan, pababa. And then, pag yung ibabaw naman po ng ngipin, paroon, parito, ayan, ibabrush po natin yung ibabaw. Tapos sa taas naman po, paparoon, paparito, sa kanan at kaliwa. Tapos, kailangan po nakakagat si Dino, no? Tayo, nakakagat. Paikot. Paikot naman po ang sipilyo sa lahat po ng surface ng ngipin. And then, kailangan, wag po nating kakalimutan, ano? Kailangan sipilyuhin din po natin yung ating, ayan, dila. Ayan, kailangan din po sisipilyuhin natin ang dila. Okay? Sanayin po natin na ang pagsisipilyo ay sa loob ng 2 minuto. So, sanayin din po natin na hindi magmumog. Kailangan dura lamang po. Opo, dura lamang. Wala po munang mumog, ano? Para po yung fluoride na nandun sa toothpaste, magstay muna siya sa ngipin natin at least 30 minutes. So after 30 minutes, saka po tayo pwedeng magmumog ng tubig.
Ayan, thank you so much, Doc Joy, for that. And thank you din kay Dino. Ayan. So it is advised po na wag muna tayo magmumumog pagkatapos mag-toothbrush upang manatili pa ang fluoride sa ating mga ngipin na magsisibing proteksyon sa ating mga ngipin. Okay, Doc. So any final reminders po para sa ating mga viewers?
Ugaliin din po natin yung pag-iwas sa matatamis na pagkain tulad po ng candy, ayan, ang tsokolate, gustong-gusto natin, ang ice cream, ayan po, ang ice cream. Sa mga inumin din po, tulad ng soda at yung mga powder juices, kasi marami po talaga siyang asukal. So mas maganda po, tubig lamang, yung malinis at mainam na supply tulad ng sa Manila water. So ugaliin din po natin na kumain ng masusustansyang pagkain tulad ng mga prutas, kagaya ng saging, ayan, yung gulay, carrots, ang tomatoes, kamatis, at yung pag-inom din natin ng gatas. So, ugaliin po natin ang pag-inom ng 8 hanggang 10 baso ng tubig araw-araw. At ugaliin din po natin ang pagdalaw at pagkonsulta sa mga dentista kada 6 na buwan. So at least once a year po, dalaw po tayo sa mga dentist natin.
Thank you so much, Doc Joy, sa iyong mga paalala. I'm sure marami sa ating mga manonood ang nakapag-isip na kung paano ba natin mapapanatiling malusog ang ating katawan at ang ating mga bibig. For all of us to be proud of our mouth.
Maraming salamat din sa inyo, Nix, sa Manila Water Foundation at sa ating viewers today. Let us all take care of our oral health and be mouth proud.
Thank you so much once again, Doc Joy. And I'm sure mga kaibigan, for everyone joining us in this broadcast, marami na tayong mga natutuhan from our dentists from the Philippine Dental Association. Kaya special shoutout po, nanonood po sa atin ngayon kay Dr. Stephen Almonte. Hi sir, good afternoon, the former PDA president who has been supportive of our programs and advocacies. Shoutout na rin po sa lahat ng mga dentista watching us in this broadcast this afternoon. Ayan, and now ladies and gentlemen, it's time for another Ang Tanong Live. Ayan, you already know how to join, di ba? Ayan, so comment down below and the lucky winners will receive a Clean Clio Hygiene package and the winners will be announced at the end of this live event. Okay, question number 9. Tama o mali? Kailangang maghugas ng kamay bago mag-toothbrush. 3, 2, 1, and of course, the correct answer is tama. Kailangang malinis ang ating mga kamay bago tayo magsipilyo. Ayan, question number 10. Gaano karaming fluoride content ang dapat meron sa gagamitin nating toothpaste? Ayan, 3, 2, 1. And the correct answer is, sana makuha ng ating mga viewers ito. And the correct answer is 1,000 ppm to 1,500 ppm or parts per million na fluoride content ng ating mga toothpaste. Ayan, okay. So 1,000 ppm para sa mga 5 years old pababa at 1,500 ppm para sa mga 6 years old pataas. Okay, next question. Ayan, marami na akong nakikitang mga sagot sa ating comments section. Question number 11, eto na po. Gaano katagal tayo dapat nagtutoothbrush? In 3, 2, 1, and the correct answer is 2 minutes. Ayan, 2 minutes. Kailangan ganun katagal tayo nagtutoothbrush. Okay. Alright, meron pa akong dalawang tanong. I hope you're ready for this. Question number 12. Ito medyo madali. Tama o mali? No? Hindi dapat magmumog pagkatapos mag-toothbrush upang manatili ang fluoride sa ating mga ngipin na nagsisilbing proteksyon dito. Ayan, hindi dapat magmumog pagkatapos mag-toothbrush upang manatili ang fluoride sa ating mga ngipin na nagsisilbing proteksyon nito. Tama o mali? In 3, 2, 1, and the correct answer of course is tama. Okay, hindi na tayo kailangan magmumog para may proteksyon ang ating ipin from the fluoride na mula sa ating toothpaste. And question number 13. Ilang beses dapat tayong nagtutoothbrush sa isang araw? In 3, 2, 1, and the correct answer is at least twice a day. Ayan, may nakalagay na at least kasi pwedeng mas madaming beses. Pero sabi ni Doc kanina, sa ating pagising sa umaga at bago tayo matulog sa gabi. Ayan. Pero sabi naman ni Doc, at least. Yung iba sa atin, every after meal, nagtutoothbrush. Okay lang din po yun para mapanatiling malinis ang ating mga bibig and you can still be mouth proud. Ayan. Okay, so antayin natin ang announcement of mga winners mamaya. Baka isa ka na sa ating mga lucky winners, kaya stay tuned mga kaibigan. Ayan, mukhang marami na tayong natutunan mula sa ating mga dentist. Thank you so much to the Philippine Dental Association for this collaboration. Last March 10, mga kaibigan, kasama ang PDA, we turned over a 3-faucet hybrid hygiene facility in Barangay Cayabu in Tanay, Rizal. At nagbigay din po tayo ng hygiene and learning supplies para sa ating mga kapatid na mga indigenous peoples doon sa community na yon. And through the sponsorship of Velusa Corporation and Lamoyan Corporation, we also brought them hygiene products. To witness the inauguration and other fun activities on that day, let's all watch this.
ang bibig. Kaya po ang aming mga face shield ay nakafocus mayroong frame. Pagtuunan natin ang pansin. Maraming pong salamat sa pagkakataon na inyong binigay para kami po ay maging instrumento para po sa kabutihan at kalusugan ng ating pong mga mamamayan.
Gusto namin talagang makatulong sa mga taong talagang nangangailangan. Yung mga taong walang access to water, to clean water. So katulad nito, ang Barangay Cayabu, Tanay Rizal.
Nung wala pa kayo rito, wala pa yung mga ganitong facility, ang mga tao rito ay kung saan-saan lang na tututbrush o minsan wala ang toothbrush. O kung minsan yung ano ng yung mga stem ng yun ang ginagamit na panglinis, no. So, lalo na yung mga ano natin eyepiece. Hindi nila pinagkakaabalahan ng pansin yung mga bagay na napaka-importante sa katawan.
Noong una pong hindi pa kayo nakakarating dito, ang mga katutubo kasi noon ay mga kaugalian, yun, hindi na alam yung naghuhugas nga sila pero hindi na nagsasabon, nagsisipilyo pero paminsan-minsan lang.
Ang oral health ay napaka-importante dahil ang bibig natin kung saan nandoon ang ating mga ngipin ang siyang tumutulong upang manguya natin mabuti ang mga pagkain na ating kinakain. Itong mga pagkain na to ay ang nagsisilbing nutrisyon ng ating buong katawan.
Napakalaking tulong sa amin dahil binigyan kami ng atensyon ng Philippine Dental Association at ng Manila Water Foundation. Bihira yung mga ganitong organisasyon na sincero na maituloy-tuloy ang pagtulong sa mga, lalo na sa mga kapuspalad nating mga eyepiece. Doon sa na-address nila ang talagang problema ng isang komunidad. In behalf of the people of Cayabu, kami po ay lubos na nagpapasalamat sa Manila Water Foundation, Telusa Corporation, Philippine Dental Association sa walang sawang pagtulong sa mga kapuspalad na eyepiece community dito sa Kabundukan. Thank you and more power and God bless you.
Wow! Habang pinapanood ko po ang video mga kaibigan, talagang nakangiti lang ako sa tuwa dahil sa nakita nating pagbabagong dala ng pagtutulungan. And now, this is just one of the many initiatives of Manila Water Foundation to celebrate World Oral Health Day. And we celebrate it for a whole month. This March, with Philusa Corporation, we distributed hygiene items to the following institutions, where we reached out to more than 2,000 individuals. We went to the Pagsanghan Municipal Health Center, the Peregrina Rebong Dator Memorial Health Center in Laguna, and Gregorio del Pilar Elementary School, which is a COVID facility. Now, we also went to San Vicente Gulod Elementary School and Obando Rural Health Unit in Bulacan. We also handed over hygiene products for various daycare centers in Calasiao, Pangasinan, and the donations were received by the Calasiao Mayor himself, Mayor Joseph Arman Bauzon. Siya po yung nakaputi dito sa ating nakikitang picture na ito. The institutions received Clean Clio Economy Toothbrush, Clean Clio Green Tea Toothbrush, Clean Clio Dental Floss, Clean Antibacterial Foaming Hand Soap, Clean Ethyl Alcohol, Clean Tissue Rolls, and Rhea Povidone Iodine with Clean Cotton. Ayan, but wait, there's more mga kaibigan. With Lamoyan Corporation, we will continue to distribute Happy Toothpaste and other products such as Lice Alice and Daz Dishwashing to our partner communities. Do watch out for that on the Manila Water Foundation Facebook page. Ngayon po, iniimbitahan ko kayo na bisitahin ang page ng Manila Water Foundation at kung may wash news or wash balita kayong nagustuhan, i-like na ito at pusuan. Ayan. And I would like to take this opportunity once again to express our gratitude to all our partners. Maraming salamat po for tirelessly working with us in implementing our mission of bringing wash for all communities. Now, before we end, ladies and gentlemen, let us hear from the President of the Philippine Dental Association. Let us all welcome Dr. Alvin Laxamana.
Greetings and good day to all. The FDI World Dental Federation for 2021 and 2023 centers towards valuing and taking care of your mouth. During this celebration of World Oral Health Day on March 20, for the next 3 years, the message "Be proud of your mouth" must cross boundaries of race, nationality, and social status. The campaign of raising awareness of the importance of oral health has been inherent to the Philippine Dental Association, for we do believe that oral health is an integral part of general health. You cannot be healthy without oral health. Our organization is pleased to partner with Manila Water Foundation. 3 years na kaming partner ng foundation. Patuloy na kami ay nagbibigay ng pagpapahalaga sa kalusugan sa pamamagitan ng tamang paghuhugas ng kamay at tamang paraan ng pagsisipilyo ng ating mga ngipin. Tumutulong din sa mga lugar na nangangailangan ng hygiene facility upang magkaroon ng access sa mga gawaing ito. The partnership of Philippine Dental Association and Manila Water Foundation proved that no pandemic can stop a very noble cause for the underserved communities. My deepest gratitude to the foundation headed by Mr. Reginald Andal, the Executive Director of MWF, and for giving us another year to team up with us, the PDA. Sa mga estudyante, kayo ang pag-asa ng bayan. Maging tama ang inyong pamamaraan ng pagiging healthy, lalo na ngayong panahon ng pandemic. Maghugas ng kamay ng tama at magsipilyo ng ngipin. Sa mga magulang at guro, kayo ay inatasan na ituro ang tamang pamamaraan ng paghugas ng kamay at pagsisipilyo ng ngipin. Ito ay para sa kalusugan ng inyong mga pamilya at ng pamayanan. Ako ang presidente ng Philippine Dental Association, nagpapaalala sa inyo na magsipilyo ng ngipin 2 beses sa isang araw sa loob ng 2 minuto, gumamit ng fluoridated toothpaste, kumain ng masustansyang pagkain at pumunta sa inyong mga dentista. Maraming salamat at mag-iingat po kayong lahat.
Thank you so much, Doc Alvin. It has always been a meaningful collaboration with the Philippine Dental Association. And there you have it, mga kaibigan. Maraming salamat po for celebrating with us. At this point, we invite everyone to answer the event evaluation using this QR code flashed on your screen. Let us know how the broadcast went for this afternoon, or it is through the via the link provided in the comment section for your certificates naman. Ayan. So may QR code tayo dito sa ating mga screen para sa ating event evaluation. Okay. Ang dami nating natutuhan, di ba, mga kaibigan? At syempre, marami ring nag-aabang ng mga prizes, sa ating mga prizes, no? But before we end, let me announce our winners for this afternoon's contest. First, the winners of Ang Tanong Live. Ayan, congratulations. You will receive a Clean Clio Hygiene package. Ayan sila, 1 to 7 ang ating mga nakikitang pangalan. Tingnan nyo kung kayo ba ay isa sa mga na-raffle na mga pangalan. Okay? Next, ayan, so 8 to 13. So 13 winners natin for the 13 questions. Ayan, biruin nyo yun. Naka 13 questions tayo for our broadcast. Next naman po, mga kaibigan, are the winners of our 100 pesos na load. Thank you for joining us this afternoon. So here they are from 1 to 10. Congratulations to all our winners. Ayan po, kindly send a message to Manila Water Foundation's Messenger account to know the details on how to claim your prizes. Again, mag-message po tayo sa Manila Water Facebook page para malaman kung paano nyo i-claim ang inyong prize. Okay, thank you. Ayan. Now, ladies and gentlemen, let us help spread the word about a proper oral health. Share the advocacy with your friends and family by joining Manila Water Foundation's World Oral Health Day weekly contest, Ang Tanong. Ayan. And get a chance to win amazing prizes. You may visit the Manila Water Foundation Facebook page to view the contest mechanics. Ayan, sali na everyone. Okay. Ayan. Thank you very much once again for joining us in our broadcast this afternoon. This is Nix Hipolito greeting you all a very happy World Oral Health Day. Always remember to brush your teeth, to visit the dentist regularly, and eat healthy food, and be proud of your mouth. Maraming salamat po. Bye!
Kaya po ang aming mga face shield ay nakafocus ngayong frame. Pagtuunan natin ang pansin. Maraming pong salamat sa pagkakataon na inyong binigay para kami po ay maging instrumento para po sa kabutihan at kalusugan ng ating pong mga mamamayan.
Gusto namin talagang makatulong sa mga taong talagang nangangailangan. Yung mga taong walang access to water, to clean water. So katulad nito, ang Barangay Cayabu, Tanay Rizal.
Nung wala pa kayo rito, wala pa yung mga ganitong facility, ang mga tao rito ay kung saan-saan lang na tututbrush o minsan wala ang toothbrush. O kung minsan yung yung mga stem ng yun ang ginagamit na panglinis, no. So, lalo na yung mga natin ITs. Hindi nila pinagkakaabalahan ng pansin yung mga bagay na napaka-importante sa katawan.
Noong una pong hindi pa kayo nakakarating dito, ang mga katutubo kasi noon ay mga kaugalian, yun, hindi na alam yung naghuhugas nga sila pero hindi na nagsasabon. nagsisipilyo, pero paminsan-minsan lang.
Ang oral health ay napaka-importante dahil ang bibig natin kung saan nandoon ang ating mga ngipin ang siyang tumutulong upang manguya natin mabuti ang mga pagkain na ating kinakain. Itong mga pagkain na to ay ang nagsisilbing nutrisyon ng ating buong katawan.
Napakalaking tulong sa amin dahil binigyan kami ng atensyon ng Philippine Dental Association at ng Manila Water Foundation. Bihira yung mga ganitong organisasyon na sincero na maituloy-tuloy ang pagtulong sa mga, lalo na sa mga kapuspalad nating mga IPs. Doon sa na-address nila ang talagang problema ng isang komunidad. In behalf of the people of Cayabu, kami po ay lubos na nagpapasalamat sa Manila Water Foundation, Elusa Corporation, at Philippine Dental Association sa walang sawang pagtulong sa mga kapuspalad na IPs community dito sa Kabundukan. Thank you and more power and God bless you.
Smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health for you and me.
Beautiful smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health for you and me.
Happy and healthy, cheerful family, building a stronger community. With your dentist and his practice, a blessing to you and me.
Smile, beautiful lips, healthy gums, healthy teeth, healthy oral cavity means better health for you and me.
Happy and healthy.